Good morning. Anne-Marie here on behalf of the Chronic Pain Association of Canada. As Canada's only national charitable organization for chronic pain, we consistently receive emails from desperate pain patients all over the country. These are casualties of Health Canada and the provincial physician colleges' misguided war on opiate medicine and those who require them. They have had their pain medicine forcibly taken from them for no medical reason, with no viable alternative to take its place. It's cruel, it's inhumane, and highly unethical. This morning, we're listening to an Ontario woman who told us that she has applied twice now for medical assistance in dying. We've asked her to read her email out loud to all of you. Welcome, Margaret, and please go ahead.
Thank you. My name is Margaret, and I live in Ottawa. And I've had chronic pain for 25 years, from severe fibromyalgia, degenerative disc disease, spinal stenosis, and arthritis. I've been in constant and excruciating pain, and I've tried every therapy and medication in different combinations and doses over many years in order to keep my pain at a barely tolerable level. My body constantly feels like a blowtorch has been taken to it. I've not been able to sleep in a horizontal position for about 20 years, and I'm housebound due to the intense pain. Even dressing to go out has been impossible on many occasions. Simple tasks, just like opening mail, preparing food, and maintaining good hygiene, are agonizing and monumental tasks. I would rather have my medication back or be allowed to die peacefully through MAID and continue with no quality of life and in so much daily pain. 5 years ago, as of January of 2021, my pain specialist took me off the opioid injections I'd been getting and that had been giving me a reasonable quality of life. He did that because of Health Canada's crackdown on doctors prescribing the much-needed opioids from pain medications or pain patients in a misguided and futile effort to slow overdose opioid deaths from illicit street drugs. My doctor stopped because he was being investigated for his prescribing methods for his patients. I cannot express the heartbreak and desolation I experienced when he told me that I could no longer be prescribed medication that had saved my life. I could not believe that the one thing that had given me a reason and ability to go on living was denied to me. I specifically had a psychological evaluation done at the Royal Hospital in Ottawa, then sent a request for medically assisted dying to dying with dignity for the second time. The physician that was sent to assess me said that because I wasn't going to die from the pain, I would not be considered. Late last year, I went by ambulance to a local hospital because the pain had become intolerable, and it took over 8 hours to get anything for my pain. I was then told by the attending ER physician that my file would be flagged and that I was not to receive any opioids from that day forward. I called the head of the department, and she had that removed after we spoke.
Margaret, if I can just interrupt there, I'm just wondering, what was that about? An ER physician wrote in your file specifically that you were no longer to receive any opiate medicines from the day this person saw you onward?
That's correct. I had been there a couple of times over a couple of years.
Mm-hmm.
It wasn't like I was going daily.
Right.
And I was just flabbergasted that he said that. So I just called the head of the ER department and said, is that possible? Like, is he allowed to do that? And she said no. And then she had it removed off my file.
Okay, interesting. Do you know for a fact if that was removed, or you were just told that it was removed?
I was just told.
Okay. Sorry for the interruption. Carry on.
No, that's no problem. I had recently attended a chronic pain management program at the Ottawa General Hospital from May to August of 2019, and the physician there refused me any pain medication. And after seeing her twice, she said she would no longer be of any help to me. The only saving grace was my limited visits with a psychologist who had helped me with my anxiety and some of my PTSD. And that brought my pain level down from a 10 to an 8. Since the program ended, I'd had no help for this pain at all. I feel that my human rights have been trampled, and I deserve to enjoy what time I have left after being able to do some of the things that that used to bring me some semblance of normalcy and joy. Our pets get better pain care than we do. Desperate, I wrote to the Prime Minister, my MP, and MPP, the Canadian Pain Task Force Secretariat, and the Minister of Health. What I got back can only be described as, we don't really care. Responses from the PM and the Health Professional Appeal Board in Ontario. Ontario's Health Minister, Christine Elliott, did not respond. A letter to my sister had written for me to the College of Physicians and Surgeons was replied to with, "That's not a problem." The director of the Canadian Pain Task Force Secretariat, Andrew Curry, did write back on behalf of the Prime Minister and the Health Minister. In her email, she said, "Please accept my sincere sympathy for the severe pain you experience on a daily basis and the challenges you are facing in finding the care you need to better manage your pain. I know that chronic pain can be a debilitating condition that affects not only the people living with the pain, but their loved ones as well. It is important for us to hear from Canadians like you who live with chronic pain so that we can better understand and respond to their needs. Thank you for taking the time to share your experience with us." They were willing to listen to these sad stories, but do nothing to alleviate the suffering. When they had the resources to do so, Ms. Curry went on to say, I would like you to know that Health Canada has recently established Canadian Pain Task Force, a group of external advisors that will help us better understand and address chronic pain in Canada. Some members of the task force live and have lived with chronic pain themselves. Others are healthcare providers and researchers with expertise in the prevention and management of pain. All are committed to improving how pain is addressed in Canada. Please rest assured that I will share your story with them. I would also like you to know that they too are working to promote safer patient-centered opioid prescribing, people living with pain foremost in mind. They will also explore ways to improve access to a range of pharmacological, psychological ways to help improve and physical therapies that can help address pain, and they will discuss the difficult subject of medical assistance in dying as part of their deliberations. Health Canada recognizes that it's crucial to consult with a wide range of stakeholders and different perspectives across the country in order to get the best advice on how to address this important health issue. That is why the task force will be consulting with Canadians and stakeholders both online and in person in the next year to help identify and share best practices for chronic pain management and prevention. If you would like, we would be pleased to add you to our list of individuals to contact regarding these consultations.
So, Margaret, if I can interrupt again.
Yes.
All of these words, I can't imagine how long it took you to actually type in this email.
Yeah.
All of these words from Andrea Curry on behalf of Health Canada and also the Canadian Pain Task Force, what do these words mean to you? How do you feel about them? How did you feel when you read this?
I was really disappointed. I expected a much quicker resolution to what I've been going through for so long, and it just seems endless, and it just seems like more words and no action.
Right. So all of these players had a hand in taking away your medication, chasing your doctor out of his practice, and now they're saying we're exploring ways to help you?
Yep. Yeah, and I haven't gotten back any positive feedback whatsoever. Just, more of the same, we're doing this study or we're forming this task force. And it's like, how does that help me right now when I'm clinging by a thread?
Right. It doesn't help you. It doesn't help you at all. It's just empty words.
No.
Okay. I'll just let you finish off then, Margaret.
So, Health Canada, which caused these problems, is aware of the fact that they caused the problem, but instead of reversing it, they're wasting valuable time and prolonging the suffering by consulting with people on how to resolve it. And when the answer is right in front of them, retract your orders to doctors and encourage them to go back to treating each patient with what they need. Meanwhile, people like me, there are many of us, continue to suffer. Suicide is our only option. This is a level of cruelty that is very difficult to fathom, and it really has to stop right now.
Oh, Margaret, I'm so very sorry you're going through this. We all are, and please know we won't stop trying to get the word out on your behalf and everyone like you. But where does that leave you now? You had a, quote, bona fide pain doctor say, there is nothing I can do for you. So you were sent away from a pain clinic. And what about your GP that you have now? Is there any discussion?
Yes, I recently was able to contact her, and I went in for pain injections in my chest, and I asked her if she could possibly give me a prescription for the pain med, which is the only thing that's helping. It's injectable hydromorphone. It's only 2.5 milligrams a day. That's all I'm asking for. And she said that she couldn't do it. She only treats people with opioids who are dying. And she has referred me back to that same pain clinic. It was unable to help me in the end. And it left me feeling really hopeless.
Right.
So I can't understand why Dying with Dignity told me that she should be able to prescribe for me, and yet she's unwilling or afraid to.
Right. Unwilling or afraid to.
Yeah.
Wow. I want to thank you, Margaret, for joining us today. And please know that we're going to stay in touch. If anything changes for you, let us know. Or certainly if we hear of any change coming down the pipes, we'll be the first ones to be shouting it out loud.
Great. I appreciate very much your understanding and your compassion.
I'm quite confident to say on behalf of everyone in Canada that you just should not be going through this. This is needless suffering, and a cruelty to which the degree I haven't seen in my lifetime up until a few years ago myself.
Yeah.
So thank you, Margaret, and we'll keep in touch.
You're very welcome.
Bye for now.
Thank you.
Bye for now.
Bye-bye.